Hey, this is Doc B coming at you from Turquoise Trail Therapeutics here in Santa Fe, New Mexico. In this video, we're going to show you several ways that we like to treat mid-back pain or thoracic spine pain. I always like to start with manual therapy. It's my go-to, and it's really where my heart is when I'm doing body work. To alleviate the pain and some of the dysfunction here in the erector spinae, I ask the patient to give themselves a big hug. I use their forearms as a lever or a handle for myself. And what I do is I shorten that muscle by extending the right shoulder back. This shortens the bellies of the muscle. I take my thumb, I put it in the tissue, and I take the patient forward while I rotate and side bend them. So this lengthens the muscle fibers underneath my tension. It's a magnificent move and really helps diminish pain and increase flexibility and motion, relative motion between those muscle fibers. I'll do multiple repetitions. I like to start low and work my way up, and then we'll hit both sides of the spine. I also like to adjust the thoracic spine. Many patients are very comfortable in what we call an anterior thoracic spine adjustment move here. I'll have the patient give themselves a nice big hug. I like to just roll the shoulder. I place a soft fist underneath the patient's back. I roll them back over my hand, and with a little downward pressure, drop, and we get nice extension of those vertebrae over my hand, which is a fulcrum, and it feels fantastic. So to further our treatment, I love using the Hypervolt, which is an amazing vibration tool. I like to keep the frequencies low, especially in the thoracic spine to start. What I'm going to do is keep a very low frequency, and I'm going to work right along the sides of the vertebra into these erector spinae muscles, the paraspinals, at a nice slow pace. We would treat both sides of the spine. I'd also treat into the lumbar and into the upper traps here. It feels great. Patients love it. Diminishes pain, gives that brain an extra sensory or an extra perception, extra stimulus to think about instead of the discomfort. I love instrument-assisted soft tissue. Again, we use a light emollient here, and I'll start with light feathering strokes to kind of calm the tissue down. And I'll work all the way up the spine. With these muscles, because the orientation of them is north-south, I will sometimes come in and scrape east-west on these fibers. It's cross-fiber friction works exceptionally well on these tissues. I can also do it with my thumbs. Get great results with cross-fiber friction in this muscle group. And then one of my best friends here is a silicone cup. Once I have just a little bit of emollient on there, these cups are fantastic. So much of what we do is compression of the tissue, especially as manual therapists. We are compressing. After a while, the tissue really likes some decompression. These cups are magnificent. They create a little bit of tension on the skin, the superficial fascia, and that top layer of muscle tissue, and we can glide the cups back and forth to create some relative motion between those tissues. Furthermore, we can grab a second cup and create opposing forces back and forth, away from one another. We can do circles in opposite directions and really challenge that superficial fascia in different directions and different trajectories. This will really liberate that tissue and enhance movement of the thoracic spine. These are all great tools that we have here at the clinic. We don't have to use them all. I think one of the best parts of treatment is trying to find the right tool for the right job, right? When you're a hammer, everything looks like a nail. In this case, we got to figure out which tool is going to be most appropriate. We may dry needle this tissue. If there's a lot of what appears to be neurological tension, the fine filament of a dry needle is exceptional in this area as well. So these are ways that we love to treat here at the clinic. If you have any questions, feel free to reach out in the comments below. Also, if you got some good information from this video, please feel free to subscribe and like this video today. Thanks for taking time out of your day to watch, and we'll catch you on the rebound.